very similar in, I'm going to say, effect as prior bills have been in the past, in that it is a government run program
Very similar
designed to pay
in,
healthcare
I'm going to say,
costs
effect
for individuals
as
who pay
prior
a fee
bills have been in the past,
to
in that
participate in the
it
government
is
run
a
program.
government-run
It is not traditional
program, very
insurance.
similar,
It is
designed to
not
pay
regulated by the
healthcare
insurance
costs
department,
for
and it
individuals
does
who
not have all the Affordable Care Act protections built in. Quite frankly, what it is a $50 million tax assessment on current premiums, which will increase the cost of insurance for Connecticut's middle class families. It also has a component here, which I will use loosely as a Medicaid expansion, which provides a, I'm going to say, healthcare program or benefit to poor individuals in the state of Connecticut. And it does so at a discount. And when that is provided at a discount, the loss is offset on private premium, and therefore expanding Medicaid will put further pressure on the private insurance and middle class families. At a time when middle class families in Connecticut are struggling and strapped. What is interesting and quite alarming, as a matter of fact, is the amount of, I'm going to say, discrimination that the comptroller would be enabled to undertake in the management of the plan, and its ability to, I'm going to say, or the consequences of adverse selection would be allowed. In other words, the comptroller can cherry pick who he wants to participate, who he doesn't want to participate, and actually can charge extra for individuals who may have pre-existing conditions. So these are very, I'm going to say, alarming issues uh, that is runs contrary to what I would call are the promises of the Affordable Care Act. Number one, affordability. Number two, quality. And number three, access. We know coming at this time in this pandemic, knowing and mindful of the results of the Mathematica report, which was an indictment on the Medicaid reimbursement rates, that we as a state would want to move forward to put more people on Medicaid and seek to expand Medicaid. And for lack of a better term, it's more or less Medicaid for all. And the question I have is, how does an individual buy onto a welfare program designed for the poor? And putting people on this program, mindful of the state's, I'm going to say, history, which Mathematica points out was a big contributor to what occurred in nursing homes this past spring, because the artificially low Medicaid reimbursement rates meant that there weren't investments in capital infrastructure like HVAC systems. There wasn't investment in infection control. And it wasn't the type of funds available to provide to labor. Make no mistake, this is not a business friendly partnership. We are not going to keep the good paying actuarial and insurance jobs. This is a government run program that's going into direct competition with a flagship industry. The only thing that is going to be a partner is in processing claims, more or less clerical and administrative in nature, which is what I think, and this is where I think the parties really differ, is that the majority looks to minimum wage and low-level jobs as the solution, where we would rather have good-paying middle-class jobs. Our reinsurance program can provide the same amount of premium relief. It actually gets its arms around the growing costs of medical care, which is the driver, and it keeps the good paying Connecticut jobs because we're not going into competition with our flagship industry. So I think this runs contrary to the promises of the Affordable Care Act because I don't believe it will reduce cost. I don't believe that it will provide a better quality product because Medicaid has not been the gold standard by any means, and many providers don't take Medicaid because it's a single payer system, which will reduce access. I think at the end of the day, this proposal runs contrary to the promises of the Affordable Care Act, and that is why we would prefer the reinsurance because it does all those things. It's more affordable, it maintains quality, and will keep access. With that, I'll turn this over to Senator Hwang and Representative Kara Pavelat-D'Amato.
Thank you, Senator Kelly. I want to thank everybody for joining in. Despite the technical difficulties, it's important for us to share with you the message that when we finally got Senate Bill 842 late last week, we've been trying to make up for lost time to really understand the content of the language and its consequential impact. We're still very much working on it, and I do believe it's a bit of a surprise, but we're going to accommodate that. There is going to be a public hearing tomorrow, and we will hear many viewpoints. And as a ranking member, I'm eager to hear the many viewpoints so that we can craft a solution. Let me be clear. Democrats and Republicans believe that healthcare and the cost of healthcare need to be managed, and it is a critical focus for all of us. And as Senator Kelly articulated, is we have a different viewpoint. And that being said, to me, initially, this looks like another state takeover program of policies that will impact so many of our residents in the state of Connecticut. And I am eager to find out more of the real facts instead of the promise as well as the premise. As I've learned in healthcare in my 11 years in the legislature, it has been an issue that's been addressed and needed to be addressed on a multiple basis. But we have not been able to get to the solution because it is so embedded in a wide ecosystem. That being said, Senator Kelly has been a lead in this area in understanding how we can contain cost. And I do know that the Senate Republicans and the House Republicans have proposed in the past a collaborative effort to try to make this bill better. And I hope we will continue doing that. But at the same time, I think the initial premise right now is this bill 842 has been brought forth without any input from myself and I'll let the House ranking member speak for herself in being able to offer our solutions in this. So in this press conference, I hope that we will send the call that we are ready to work together to try to find a better solution, a viable solution, a solution that works in reality than the premise and the promise that we can solve real world difficult problems by simply creating theoretical solutions, and also for us to be able to investigate and get much better understanding of the partnership program that has been in existence right now, to see how it's really functioned and how it has managed the finances to indeed find out transparently if it is indeed in the red as a functioning health insurance pool system, so that indeed we don't put the burden on the ultimate risk people in this bill is the fact that it is the taxpayers of the state of Connecticut that will be ensuring this program. So the idea of fees or taxes on middle-class Connecticut residents, and also a potential plan that, based upon its current operation, has demonstrated it may not have the actuarial risks, proper risk assessments for the promise that it provides. So I'll refer to my House ranking member, Representative Pavlik D'Amato.
Thank you, Tony.
And I do see that we do have questions, and we'll make sure that we get to acknowledge your hand function, whatever how we work it out.
This is my now second term as ranking on the Insurance and Real Estate Committee. And what I've seen is, and what's concerning is that we're taking the same concept, but putting a different name on it. We've had the Affordable Care Act, which ended up with high deductibles. We've had the partnership plan, again, similar, but is now, or at least in 2019, $30 million short. And now public option. And instead of fixing what we have, we're just coming up with a new name, new packaging, same concept. Other parts of the bill that were concerning was not only the lack of transparency, but also the control to one person. Granted, it did have some parts where there was the, I think, Office of Health Strategy or a couple others that there was input, but the fact that the comptroller has the authority and ability to reject applicants really doesn't make it a public option at the end of the day. There were also guarantees. The fact that guarantees that rates could not be raised more than 3%, and the potential impact of where some of the money shifts, where at the end of the day, where it's coming from, whether it's the taxpayers or the remaining private insurers. Again, all issues that I hope we address in the public hearing and get answers to. But there are concepts that we do agree on. And I am not sure why we don't, as a committee, focus on some of these concepts like the benchmarking and a couple others that we never seem to be able to push to the goal line. And I think if we did focus on some of these, it could make a positive impact on our insurers in the state of Connecticut and make it more affordable. Like Senator Kelly said, we're not addressing the underlying price drivers. And this bill, I don't see as getting us to reaching that goal. I think it's, initially can come off as something that would be attractive to small employers. But again, when it's just shifting costs to other people, and when you have to reach into the general fund to make up what it potentially will fall short, then it's just shifting and hiding. It's not, at the end of the day, cost savings. So I'll turn it back over to my colleagues, and we can take questions from there if that's possible. Thank you.
So, Sarah, I understand that Connecticut News Junkie has a question for Senator Kelly, and I believe you can go to the raise hand function under the chat menu, or you can just post it onto the on the participant menu, or you can just post a question on chat and we'll get to you. Would that be all right, Sarah?
Okay.
So I guess Connecticut News Junkie and whoever wants to go next.
Okay. Thank you, Senator. My question was on, is it your understanding on the Senate Bill 842, which is the Democratic proposal, that they are looking to set aside about $25 million for this new subsidiary under the exchange that would be allowed to help purchase insurance for undocumented people?
Yes, in addition to the 50 million assessment, there's another 25 million. So you're looking at a $75 million tax. And what they're looking at is contracting out, and this is my interpretation, contracting out both Medicaid and SNAP to the exchange. And it would be for individuals who would otherwise not be eligible for Medicaid. And there are, in addition to individuals who are not citizens of the United States, because in order to participate in Medicaid, you have to be, but it would also include individuals who I think it would provide medical assistance regardless of assets.
And why is it, do you think, that they've abandoned the application for the federal reinsurance waiver?
That's a good question. I don't understand why, because I think it makes abundant sense from a whole host of different reasons. First and foremost is that it keeps great paying jobs here in the state of Connecticut. It's regulated by our insurance department, which are some of the best regulators in the country, if not the world. And it is a product that is ACA compliant. And the thing that is also interesting is that it leverages money out of Washington, as opposed to putting a $75 million burden on Connecticut's middle class. I don't get it, but then I'm looking at it from the middle class perspective.
Thank you.
Stephen Singer.
Hi, thank you. Senator Kelly, the dollar amount that you're mentioning, are they in the bill itself, or is that from some other information? The 50 million in particular, and the 25 million you just referenced.
The 25 was referenced by Christine Stewart there, so I don't have. I know that was it's in the bill. I don't know exactly where, but the 50 million is at line 225.
Okay.
So these are both in the bill.
And is there an alternative that the House and Senate Republicans are going to offer to Senate Bill 842? If you believe that health insurance costs are rising too rapidly, is there a proposal you're going to make to bring costs more in line, or to bring costs down a little bit?
Yes, our plan, I believe, is Senate Bill 502, and Senator Hwang will correct me if I'm mistaken. I think it's 502. But what it is it's the reinsurance program, which would utilize reinsurance, which can go, we can drive premium as low as you want to do it. It includes the benchmarking, which gets our arms around the high costs of medical care, which is the real driver. And it partners with our private insurance industry. And so we keep good paying Connecticut jobs here. And people get to keep the insurance that they understand and that they know and they've been using. So this is good for Connecticut's middle class because it leverages money out of Washington. We're going to get a federal buy-in utilizing a 1332 waiver under the Affordable Care Act. So you're plugging in the Affordable Care Act protections. We're providing premium relief. We're getting our arms around the costs of medical care and keeping good paying Connecticut jobs. This was also the subject of a Wakely report, and I believe it was in 18 and 19 that was commissioned by the exchange, which agreed that we would leverage money, and our funding comes from the general fund, not through a further tax on Connecticut's middle class. We're going to work within the budget that we have in order to pay for what I'm going to say Connecticut residents, when I go door to door, they tell me the number one issue is making, healthcare more affordable. Healthcare premiums in Connecticut are way, way too expensive. They are crushing the middle class family. Middle class families in Connecticut were promised 8 years ago by the Democrats that they would have affordable health care. That promise has not been delivered. And what we believe is our way is the better way. Our way can provide that, keep good paying jobs, and get our arms around medical costs. This public option does none of that.
Thank you.
And Stephen, the 25 million is referenced in line 778 of the bill.
Thank you very much.
And if I may add, indeed, Senator Kelly, it is Senate Bill 502. In addition to the comments and the solutions offered by Senator Kelly, we also added a significant measure of using benchmarking and looking at comparable states that have implemented some cost containment savings, such as Massachusetts. The other component that is of interest is the fact that we are requiring an audit of current existing programs to ensure transparency and a real fact-based analysis of programs as to whether they work or not. I think we have an important fiduciary responsibility to the taxpayers of this state to ensure that any program that we prove as a legislative body is functionally self-sufficient and will not, in the long run, go into the pocket of Connecticut taxpayers to fund the liability. So there was an important component of 502 that asks for transparency and audit of these kind of programs as it's being implemented and imposed on the residents of the state of Connecticut.
Thanks.
Are there any other questions? All right. Well, we thank you all for being here today on such short notice, and we will be available if you need any further information. Thank you.
Thank you.